Continuation of Chapter 8 of the ACE Personal Trainer Manual. I'm going to reread what I left off with, girth measurements, and then read Table 8-9. Girth measurements. Girth measurements are not only good predictors of health problems, e.g. waist circumference as it correlates to heart disease, but an overall body assessment will also provide motivation as clients see changes in their body dimensions. In the case of excess fat mass, clients will be inspired by a decline in girth measurements, while individuals who are interested in muscular hypertrophy will likely be motivated by increases in girth. When taking girth measurements, precision is necessary to validate the results. To ensure accuracy, the personal trainer must use exact anatomical landmarks for taking each measurement. Tables 8-9 and figures 8-7 through 8-9. Table 8-9. Standardized description of circumference sites and procedures. Abdomen. With the subject standing upright and relaxed, a horizontal measure is taken at the greatest anterior extension of the abdomen, usually at the level of the umbilicus. Arm. With the subject standing erect and arms hanging freely at the sides with hands facing the thighs, a horizontal measure is taken midway between the acromion and the olecranon processes. Buttocks and hips. With the subject standing erect with the feet together, a horizontal measure is taken at maximal circumference of the buttocks. This measure is used for the hip measure in the waist-to-hip ratio circumference measurement. Calf. With the subject standing erect, feet approximately 20 centimeters or 8 inches apart, a horizontal measure is taken at the level of the maximum circumference between the knee and the ankle, perpendicular to the long axis. Forearm. With the subject standing, arms hanging downward but slightly away from the trunk, and palms facing anteriorly, a measure is taken perpendicular to the long axis at the maximal circumference. Mid-thigh. With the subject standing and one foot on a bench so the knee is flexed at 90 degrees, a measure is taken midway between the inguinal crease and the proximal border of the patella, perpendicular to the long axis. Upper thigh. With the subject standing, legs slightly apart, approximately 10 centimeters or 4 inches, a horizontal measurement is taken at the maximal circumference of the upper thigh or the hip, just below the gluteal fold. Waist. With the subject standing, arms at the sides, feet together, and abdomen relaxed, a horizontal measure is taken at the narrowest part of the torso, above the umbilicus, and below the xiphoid process. The National Obesity Task Force suggests obtaining a horizontal measurement directly above the iliac crest as a method to enhance standardization. Unfortunately, current formulae are not predicated on the NOTF suggestion site. In addition, procedures must be followed in accordance with established guidelines. When measuring body circumference, it is important to measure precisely and consistently. All measurements should be made with a non-elastic yet flexible tape. The tape should be snug against the skin surface without pressing into the subcutaneous layers. Individuals should wear thin, form-fitting materials that allow for accurate measurements. Trainers should rotate through the battery of sites, initially measuring each site only once. Duplicate measurements should be taken of each site. If recorded values are not within 5 millimeters, it is necessary to remeasure. Trainers should wait 20 to 30 seconds between measurements to allow the skin and subcutaneous tissue to return to its normal position. Apply what you know. Taking the stress out of circumference measurements. Many overweight and obese clients find the process of having their circumference measurements taken to be an unpleasant and demotivating experience. To help alleviate their uneasiness, personal trainers should consider using an alternative technique that eliminates the numerical values that many clients find so upsetting. For example, personal trainers can use a ribbon to measure the circumference, cutting the ribbon at the appropriate lengths. Then, when the measurements are repeated later in the program and the ribbons are noticeably shorter, the personal trainer and clients have a very clear visual representation of the progress made. Waist to hip ratio. As mentioned previously, excess body fat poses significant health risks. The location of the fat deposits may even be a better indicator of disease risk. The WHR, or waist-to-hip ratio, helps differentiate android or apple-shaped individuals from those who are gynoid or pear-shaped. Those who are apple-shaped carry excess fat in the abdominal area, while pear-shaped individuals carry excess fat in the hips and thighs. Though any extra fat weight is detrimental to a person's health, those who are android and have a high waist-to-hip ratio have a greater health risk. To determine the client's waist-to-hip ratio, the waist measurement is divided by the hip measurement. Table 8 TAC 10 illustrates the relative risk ratings for waist-to-hip ratios. Waist-to-hip ratio norms. Gender, males, excellent is less than 0.85. Good is 0.85 to 0.89. Average is 0.90 to 0.95, and at risk is greater than 0.95. For females, excellent is 0.75, good is 0.75 to 0.79, average is 0.80 to 0.86, and at risk is greater than 0.86. Waist circumference. Visceral fat contributes to android fat distribution and is very damaging, not only because it encroaches on the vital organs of the body, but also because excess abdominal fat has been associated with insulin resistance. There is a strong correlation between excess abdominal fat and a number of health risks, including type 2 diabetes, hypertension, and hypercholesterolemia. For every 1 inch, 2.5 centimeters increase in waist circumference in men, the following associated health risks are found. Blood pressure increases by 10%, blood cholesterol level increases by 8%, high-density lipoprotein decreases by 15%, triglycerides increase by 18%, metabolic syndrome risk increases by 18%. Table 8 TAC 11 presents the risk categories associated with various waist circumferences for men and women. Risk category, very low. For females, that is less than 27.5 inches or less than 70 centimeters. For males, that is less than 31.5 inches or less than 80 centimeters. Low risk category is females with 27.5 to 3.5 inches or 70 to 89 centimeters. Males, it's 31.5 to 39 inches, 80 to 99 centimeters. High risk category are females with 35.5 to 43 inches or 90 to 109 centimeters. High-risk males are males with 39.5 to 47.0 inches or 100 to 120 centimeters. And very high-risk category is a female with greater than 43.5 inch waist circumference or 110 centimeters, and males with a greater than 47 inch waist circumference or 120 centimeters. Many of the tests measuring body size and proportions can be used in conjunction with body composition testing. Testing protocols are basically the same for all of the anthropometric tests. These tests should be performed prior to exercise. The trainer should explain the procedure for each test and ensure that the client is comfortable with the proposed measurement sites. Each measurement must be performed using the precise landmarks. The trainer should record values on the testing form and evaluate and classify the client's measurements using normative data. Trainers should discuss health and fitness concerns related to abnormal readings and educate clients on strategies to reduce personal risk and improve overall health. Key concept. Many people are often successful at losing weight or fat, but are unsuccessful at long-term weight management. It is important for the personal trainer to emphasize that exercise is a key component not only in effective weight loss, but also in maintaining a healthy weight. Exercise enhances daily caloric expenditure. Exercise, especially strength training, can minimize the loss of lean body weight, and exercise may suppress appetite and counteract the impact that diet may have on resting metabolic rate. Exercise makes the body more efficient at burning fat. Estimating body fat from circumference measures. Body density for women and men can be predicted from generalized equations that use girth measurements. There's a very complicated looking, i.e. uses very small values that are in decimal form that is laid out, so it's worth taking a look at on page 212. Here is an example. I won't go over all the numbers, but it will help possibly with the exam. Edgar is a 36-year-old client who weighs 235 pounds or 106.7 kilograms. Calculate his body density and percent body fat from the following circumference measurements. The iliac circumference is 110 centimeters, hip circumference is 113 centimeters, abdominal circumference is 119 centimeters. And then there's a pretty lengthy equation, and it's using percent body fat equals 495 divided by, I believe that's the Siri method, divided by body density. So you do the equation to get the body density, and then you do 495 divided by that body density and minus 450, and his body fat percentage is 38.20. That's Edgar, a 36-year-old client who weighs 235 pounds. Okay. Apply what you know. Discussing body composition using non-scientific language. Terms such as mass, densitometry, and lean body tissue may sound like a foreign language to many people. At the same time, personal trainers have to project a strong sense of professionalism, expertise, and knowledge in what they say and do to attract and keep clients. The key is in learning how to communicate with clients based on their education levels, fitness knowledge, and previous exercise experiences. A good rule is to assume that new clients have little, if any, fitness and exercise background and proceed from there. Before defining body composition, make certain that the clients understand that weight scales, height to weight charts, and BMI charts only consider total body weight or total body weight in proportion to height to indicate if individuals are of ideal weight, overweight, or obese. Anyone trying to lose weight needs to understand that they are really trying to lose fat, but not necessarily weight. Charts are not a good indication of ideal body weight for general health or for athletic performance. During a weight loss program combining diet and exercise, there are going to be times when the rate or amount of weight loss slows, stops, or even reverses, and yet individuals can still be losing fat and gaining lean body mass. The only way to know for sure is through periodic body composition assessments. There are several ways to define body composition using non-scientific language. Clients should continually be re-educated about exercise science principles and terminology as they become more comfortable and experienced with their training. Using the classic two-component model body composition is typically defined as the ratio of fat mass or fat-free body mass to total body mass. LBM, or lean body mass, is sometimes used in place of fat-free mass. Both versions are correct, and with the only subtle difference being that lean body mass includes a small amount of essential lipids, whereas fat-free mass does not. The following examples are ways to explain body composition in lay terms. Body composition testing measures how much body fat you have in proportion to the weight of your muscles, bones, and other tissue. Body composition testing is an estimate of the percentage of your weight that is fat compared to the fat-free weight, which is made up of muscles, bones, and organs. The previous sections in this chapter were devoted to resting measurements. Subsequent sections focus on physical fitness assessments that are active and require submaximal to maximal effort. Not all tests are suitable for all populations. Test selection should be done with thoughtful consideration.